Hey everyone, welcome back. So today I'm going to be talking about something that is so important in terms of how other areas in the body function, but it's often, sort of a part of the body that we don't really think about. Now, I've previously talked in other videos about how important it is to address the root cause of a problem and not just the symptoms. Unfortunately, this doesn't always happen. And one of the most overlooked areas, which I'm going to be talking about today, is the diaphragm. Now, this is also important if you are someone who's suffered from unresolved trauma. If you've watched that video, you'll know I sort of mentioned briefly about the diaphragm in the body and how they can sort of really store a lot of unresolved tension. So if that's relevant to you, do take a look at that video too. But certainly for me, I've definitely sort of come to realise the importance of the diaphragm and just how much it can impact on the rest of your health. I suffer with irritable bowel syndrome, and I found it was just after Christmas. I basically hadn't celebrated Christmas for quite a few years, and so it sort of went all out on the food and drink. A bit of a mistake, and I had increased bloating with my IBS, and for the first time ever I was starting to notice that I would walk literally 2-3 minutes up the road and I was actually feeling out of breath. And now I'd got a little bit unfit, but not that unfit, and I found that the whole of my abdomen right up to the rib cage was feeling really tight, and it actually became apparent that yes, there was bloating from the IBS, but where that was so excessive, what happened was it was pulling the diaphragm tight, and of course, as we know, the diaphragm is important in breathing, basic function, and so if that diaphragm is getting so tight, that's going to impact on your breathing and your ability for the ribs to expand with respiration, and so it started making me question as a therapist, what other issues that I treat clients with could actually be affected by diaphragmatic tension. And it's amazing how many clients, just when doing like an abdominal or specific colon massage, that you really feel a lot of tension around that diaphragm. So what other issues could be sort of associated with diaphragmatic tension? Well, if we think about lower limbs, reduced internal hip rotation with passive knee and hip flexion in the supine client can be helped with rib cage depression upon exhalation on the same side as the limited movement, and the client will also feel less of a pinch in the groin. So working on the diaphragm and pelvis can be indicated more than working on the glutes in sort of lower limb issues. If we look at upper limbs, reduced internal rotation of the shoulder can be helped with passive upper rib cage depression alongside retraction and internal rotation of the shoulder while the client inhales and exhales. Now, it may be that the issue is due to the diaphragm and the rib cage, so it's always worth looking at that, you know, with any shoulder issues. I guess what I'm saying is, you know, just it's important as therapists that you do an objective assessment rather than, you know, a client coming in and saying, oh, my shoulder hurts, and immediately thinking shoulder pathology. You know, just be a bit more open-minded and explore other avenues rather than, you know, fitting those symptoms that the client gives you into a ready-made treatment. So if we look at the effect of respiration on the diaphragm and the pelvic floor. Now, the diaphragm is it's a skeletal muscle which separates the chest and the abdominal cavities. It attaches to the rib cage and so is therefore involved in movement of the rib cage during respiration. So you can see in this picture that diaphragm that comes across here under the ribs. So as that sort of expands, it's going to help with the, you know, movement of the ribs and therefore expansion of the lungs upon inhalation and exhalation. And then here, if we look at the pelvic floor, which is also one of the 5 diaphragms in the body, it can also store a lot of tension. So the pelvic floor is basically like a hammock that incorporates the levator ani and the coccygeus muscles, which you can see around here, the levator ani and the coccygeus. This hammock separates the abdominal and the pelvic cavities and is also involved in certainly bowel and bladder function, but also in pelvic movement. Okay, so let's think about the movement of these 2 main diaphragms during respiration. So first off, if we look at inhalation, when we breathe in, that main diaphragm under the ribs, it will shorten and flatten, moving downwards, causing the transverse abdominis and the rectus abdominis muscles to expand, and it will elevate and externally rotate the ribs to allow, as you breathe in, those muscle, you know, those lungs to kind of inflate. At the same time that this is happening, the pelvic floor diaphragm also moves downwards, it lengthens, and the pelvis moves towards an anterior tilt. Then, if we look at exhalation, when we breathe out, both of those diaphragms then return to their original position, moving upward. So the abdominal diaphragm will lengthen upwards, going back into that dome shape. When you inhale, it kind of, so the diaphragm is usually like this underneath the ribs. As you inhale, it will come down and flatten as the ribs expand. And then as you exhale, it will return up, back into that dome shape, pulling the ribs in, alongside, of course, the intercostal muscles. As it returns back up to its original shape, the transverse abdominis and rectus abdominis will contract and shorten again. The rib cage depresses, retracts, and internally rotates as those lungs also deflate. The pelvic floor diaphragm will also return to its original upward position, and it will revert back to a posterior tilt. So, to summarise, with inhalation, the diaphragm and the pelvic floor move downwards to allow the organs to mobilise. But the diaphragm shortens, whereas the pelvic floor lengthens. Then, during exhalation, the diaphragm and pelvic floor move upwards to allow the organs to move together. And alongside this, of course, you've got the contraction of those abdominal muscles. And with exhalation, the diaphragm lengthens back into the dome shape, whereas the pelvic floor is going to shorten again. So, when the diaphragm lengthens into its natural dome shape, upon exhalation, the transverse abdominis and rectus abdominis contract, allowing the rib cage to depress under the diaphragmatic dome. The obliques contract, also retracting the rib cage. Now, as sports therapists, we sometimes assess a client's hamstrings by asking them to perform the toe touch test. But actually this test not only can be a good indicator of how much tightness there is in the hamstrings, but it can also actually be an indicator of diaphragmatic tension, because the rib cage has to depress and retract, and the obliques have to contract, which means that the diaphragm has to be lengthened. Now, if the diaphragm is tight, it won't do this as effectively, and the client may have difficulty performing the test. So it's just another thing, to be aware of when you're asking clients to do that test. If the rib cage remains elevated and protracted, this encourages anterior pelvic tilt, which may then impact on the hamstrings due to a change in the resting muscle length. So if, for example, a client is struggling to bend over to put their shoes and socks on, it may not be a case of looking at the spine or the glutes or the hamstrings. You may need to look at the diaphragm. Now, this action calls for hip flexion and posterior pelvic tilt, i.e. mobilising the pelvic floor to its end range, and depression and retraction of the rib cage, which involves mobilisation of the diaphragm to its end range. Now, if the diaphragm and pelvic floor are unable to mobilise in this way, then the muscle length and tension balance will be affected, which will make the movements inefficient. So, to promote maximum efficiency of the abdominal muscles and glutes, the diaphragm must be free to perform to the end range of motion during respiration. So, why does tension arise in the diaphragm and the pelvic floor in the first place? Well, there are numerous factors, there always are. The pelvic floor is covered extensively in a couple of my courses, and you'll see that information also in some of my videos about the pelvic floor. But common factors which can affect both the abdominal diaphragm and the pelvic floor diaphragm include, as we've mentioned, trauma, and certainly unresolved trauma, So you may sort of see in people with PTSD, you know, the diaphragm may be an issue. Chronic stress, any altered breathing patterns and respiratory drive, commonly due to respiratory conditions, or sympathetic dominance of the nervous system, which of course is involved in that fight or flight response during chronic stress and traumatic episodes. Hyperventilation means short and fast breaths out. So what happens is the diaphragm remains contracted for longer. Now, if you want to find out more about, obviously I've got videos on trauma and the fight or flight response, and there's also some videos on respiratory issues such as COPD, asthma, cystic fibrosis, bronchiectasis. So do take a look at those as well if you think it's relevant to you. Once the breathing pattern is altered, the accessory respiratory muscles, so we're looking at things like the scalenes, the serratus, will kick in to maintain adequate respiration. And this will then also cause further compensatory problems, and you'll start seeing tension in those muscles. And also, as I explained with myself and my own situation, abdominal bloating, so due to conditions such as IBS and other bowel disorders, again can impact on tension levels in the diaphragm. Now, I have talked previously about allostasis. So how do we maintain you know, this balance? So when chronic stress, pain, hyperarousal increase wear and tear on the body, reducing its ability to maintain homeostasis. Certain systems within the body, as we know, including the respiratory system, will, you know, find a way to adapt in order to meet the demands of the body. And in clients with PTSD, and again check out my videos on PTSD, even anticipating perceived threats will impact on the respiratory system, reducing exhalation and therefore increasing the time that that diaphragm is contracted. So conditions such as PTSD, grief, depression can also affect metabolic functions in the body, because the respiratory and nervous systems respond to the emotions rather than the chemoreceptors, and therefore this can potentially alter homeostasis in the long term. And so that's why, you know, working in clients with PTSD who are constantly stuck in this stress response is so important. It's so important to work on, you know, the nervous system, you know, and also, you know, abdominal massage can be hugely, you know, beneficial because of the work on the diaphragm. So by working on the diaphragm and desensitizing the respiratory system, a normal breathing pattern and nervous system functioning can be restored. This will enable better sleep, better metabolic functioning, and increased ability to manage pain. Now, as we've said, there are conditions that may cause abdominal bloating and shortness of breath. So we're looking at, we mentioned there, respiratory conditions, so things like COPD, cystic fibrosis, asthma, anything that will affect the breathing can cause abdominal bloating. Women's health issues such as menstruation problems, ovarian cancer, again, you know, with ovarian cancer, if you get ascites, which is like an accumulation of fluid in the abdominal cavity, this again is going to cause tension in the diaphragm and promote the chances of, you know, shortness of breath. Pregnancy, obviously, bloating, nausea, shortness of breath, increased pressure on, up under the ribs. So shortness of breath, again may occur as the fetus grows and pushes up under that diaphragm. Also stress-related disorders, so we talked about PTSD there, but also just high anxiety, panic attacks, anything that can cause hyperventilation. Digestive issues, we've mentioned IBS, but also obesity, lactose intolerance, celiac disease, constipation, and gastroparesis. And finally, cancer related. So again, we talked there a little bit about ascites, which is that accumulation of fluid, and non-Hodgkin's lymphoma can also bring on a fair bit of tension around the diaphragm. And there's other issues such as gallstones, hernias, peripheral neuropathy, pancreatic insufficiency, any overeating, or if you sort of have a habit of swallowing excessive air when you eat. This again can increase pressure on the diaphragm and encourage shortness of breath. Certain foods such as lentils, beans, cabbage, fizzy drinks, all of these can contribute to excess gas and therefore increase the pressure on the diaphragm. Now, obviously I explained with my own situation with IBS and the diaphragmatic tension that I had. This is quite common. IBS affects around 11% of people, and part of the difficulty in assessing and treating it is the sort of apparent lack of structural abnormalities. Quite often we could sort of have a scan or some other test, but there's never that sort of well-defined visible issue that comes out of those tests that says, yes, you've got IBS. So a lot of it is based on symptoms, but research has shown that electrical diaphragmatic activation in IBS patients is often dysfunctional, and this could potentially be a contributing factor to lower back pain that accompanies quite often those with IBS. And also, if the ability of the diaphragm to contract is restricted, this is more than likely going to have a negative impact on gut motility. So, visible abdominal bloating and tightness are common in IBS, and this can lead to shortness of breath due to restricted movement and increased pressure on the diaphragm. This shortness of breath can then cause quick and short breaths, which further restrict diaphragmatic movement, or swallowing air, which again increases the bloating. And so you end up in this sort of cycle of, unhealthy sort of habits. Okay, so just to explain that in picture form, if we look at a normal amount of gas in the gastrointestinal tract, so you can see here you've got the diaphragm that's sort of in a normal position, but the gaseous distension of the GI tract is really quite different following, a normal meal, in a normal healthy person where there's homeostasis and everything is working as it should, and between someone who maybe has a few more issues going on. So if we look at the normal viscerosomatic reflex, what happens is Any sort of trapped gas, which stretches the GI tract, will then result in the diaphragm rising up and relaxing, and the abdominal walls, the muscles there, will contract, and this is a normal response. However, if we think about a more problematic case where there is an abnormal viscerosomatic reflex, so this could be in someone, say, with IBS, for example, what happens is the gas stretches the GI tract, and this then causes the abdominal muscles to relax and weaken, and the diaphragm then gets pulled down, flattening it out, and the diaphragm is therefore contracting. And so if in the case of someone with IBS, this this is happening for a sort of longer period, that longer period of diaphragmatic contraction is certainly going to impact, on movement of the ribs and respiration. So hopefully I have sort of just demonstrated the importance of your diaphragm, how it can be related to other issues, and if you are a massage therapist, the importance of considering the diaphragm, considering working on that area in some cases, rather than going for the obvious sort of glutes, hamstrings, because we do get those cases where for whatever reason we can't find, we work on those sort of obvious areas and we can't find a reason, and that may well be, if you've got a client who's been through trauma or high anxiety, panic attacks, or who has some sort of respiratory issue or digestive issue, do think about the diaphragm, because that may be causing a lot of the problems. So if you can release that, then hopefully problem solved. But yeah, if you yourself are having issues, particularly with a lot of bloating, deep breathing really is quite important as well. And you'll see information about this on some of my other videos about sort of IBS and probably even the pelvic floor one. Yeah, hopefully it's given you sort of an overview of why your diaphragm is so important and giving you something to think about. Do feel free to comment down below, subscribe to my channel, and you'll be informed when other videos come out. So there are lots of other videos already up that are related to this video on the diaphragm, videos about the pelvic floor, videos about PTSD and trauma, videos about IBS, and also some about respiratory issues such as asthma, COPD, cystic fibrosis. So do take a look at those if they're relevant to you. Feel free to contact me through my Instagram or Facebook, and I will come back to you if you have any questions. But that's really all from me. If you are a massage therapist and you would like training in this sort of area, do take a look at my courses at www.medicalmassagelady.com, or alternatively you can contact me again through my Facebook or Instagram. But that's really it from me. So do take care, and I will see you on the next video. Right, bye.